allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. We're back from our recess, and before us today is George Hoyfelder and Bill Clark. George is from our health department, and Bill is from the Co-Operative Extension, and I'm blanking.
Brenda.
How are you?
How are you?
Okay.
And everybody's here to talk. Are you all three going to discuss the Lyme's disease program and progress?
Yes.
Okay.
Brenda is
Eminent
chair of the
experts on
county's
this.
Lyme disease task force, and she was going to update you on
Come.
the task force. And
I should have brought my little dog with me so you could see him just kind of hobble across. And I think it's time to. Yeah, I think he's. This isn't the first time that we've had to get antibiotics into all. Believe me, I live down in Wellfleet, so all I have to do is stand out in my yard for about 3 minutes.
You live in Tick Heaven down there?
Good. How's Susan?
Fine, thank you.
Give her my best.
I surely will do that.
did you thaw out from last night, or have you thawed out?
Oh
anymore?
my word, was that a chilly night? Yeah, that poor little dog looked like it was, arthritic by the end. It was like, can we please go
Yes,
home?
it was cold.
It was.
George, how are you? Very well.
Don't panic, we don't have to read all that today. Well, thank you very much for having us on the agenda this morning. Lyme disease, of course, is a major topic on the Cape, as you all know. Commissioner Doherty has seen some of this before.
Yes, I have.
But there are a couple of new things there. So, as I say, this is kind of a little take-home packet for you. I think you will be interested in reading it.
Good.
And I'd just like to tell you what's in it. Under the clip, first of all, is our most popular item, which is the wallet card. And we
Would you
distribute...
hold that for a little bit longer so people
Yeah,
can see
or-
that?
Oh,
Or
sorry.
actually, if you could just place them on the counter
All right.
as you pull them off, that'd be
Yes.
great.
And then, hot off the press, the second thing under the clip is the newsletter prepared by Dave Simser, our entomologist. And
I like the title, TikTok.
TikTok, and his graphics are excellent, unbelievably good. He's responsible for the effectiveness of all of our graphic material, I can tell you that. And so I think you will find that very interesting. And that comes out periodically. It's available on the internet.
They
Then-
did a great job, by the way, going through this several months ago when we had him on the program.
Mhm.
Oh yes, he has a PowerPoint presentation that's excellent. And then this is our, what we call a rack card, because it gets put into racks at places like motels, campgrounds, and so forth, with more information about Lyme disease, how to recognize it, what to do if you think you've got a problem with a tick, and so forth, with some websites on the back. That has evolved from a larger pamphlet, I should say, that we started about 10 years ago. And then, and this is receiving rave reviews, is the property management brochure.
Good.
Lots of good tips there for what people can do to try to intervene, as they say, or intercept ticks before they get close to the home. Then there's a colored paper clip which has some pages in it. I was just trying to figure out what might be interesting for you, and this is the handout that I gave to the public when I gave a talk. And I thought, well, why not? You'd probably be interested to know what we have to say. So this is the kind of thing we talk about. The third page in there is an article that appeared in the New York Times last summer, written by Jane Brody. And you may have seen it, but I think it's an excellent article, so I share that with as many people as I can. So I think you might find some of that interesting. And then what's under the steel paper clip are some things I would like to talk about this morning.
I would like to just ask a couple of questions if possible. Number one, on this TikTok brochure, the new one, I think it's excellent because you have very good pictures of the different types of ticks. And having picked many off myself and my dog, I'm aware of all of these different looking ones. The dog tick can be infected as well as a deer tick?
Not with Lyme.
Not with Lyme.
That's the good news. The dog tick does not carry the Borrelia spirochete. It can carry Rocky Mountain spotted fever, which is very uncommon.
Right.
It's not rare. We have had fatalities on the Cape in the past from Rocky Mountain spotted fever, but it is so uncommon that many physicians don't see it very often and so forth. But so it's not totally benign, but most of us natives don't worry too much about the dog ticks. They're very common. They're the most common ticks in the middle of the summer, for instance, and they're mostly the ones your pooch will pick up.
Right.
But at this time of year, May, June, the nymphs of the deer tick are out there. They're very tiny.
Right.
These photographs here and illustrations do not show you the nymphs, but they are shown on the rat card.
Yes, they
the
are.
relative sizes.
And very well, right.
And on the wallet card.
And I've pulled those off myself too, and they're really pretty.
Those are actual ticks that we just made color copies of.
Okay,
So that's the exact size.
they are so small. I remember one time I just had an itch and I kept in it. I was like, oh my God.
That's right.
That's. The other thing is, it's showing how to remove a tick. When I first moved here, they were one of your gals was going up to the COA in Wellfleet, giving out the information, giving out these cards and these little tick removers, and they are fantastic. Now you can use tweezers, and they sell them at CVS. These other tweezers that you can kind of close it and lift it off.
Mm-hmm.
But that tool there is an amazing tool, to the point where I actually get called to people's homes
That is.
as an expert in Wellfleet
Yes,
with my
yes. Let me put
trusty
one out
tool.
for
And
the
I'm so
camera.
glad that you brought another one. Thank you. These are really terrific. If people in the audience are watching, it just has a very slight fork in it, and you put it under the tick and lift it out. That way you're not squeezing it and squeezing the poison into the animal or into yourself, correct?
The other thing is, if you have a squirmy person or pooch who doesn't like to sit still while you figure out where to put the tweezers,
Right.
This is very fast, and on a dog, it slips right through the hair.
Exactly
And
right.
now it doesn't always do the entire job if you have a tick that has really taken it really kind of embedded itself under the skin. Sometimes the help of a clinic is advised, and I always advise people, don't be shy about asking for help.
Right.
If you're having trouble getting a tick out, go to a clinic, go to a nurse or some place where people have some experience with it. But these little tools are terrific. And they're much safer than tweezers, and they're easy to carry. So you can put them in your pocket. You're not going to stab yourself with them.
Yes, actually, people were calling me so much last year. When we were in the middle of the campaign, somebody had a very good slogan that they said you should put on here and give these out. I can't remember the slogan now, but it was really, it was a good one.
I advise everybody to hang it near the kitchen cabinets or something where you
Yeah,
can
that's exactly where we have it, right?
reach for it quickly. But thanks for bringing that up,
Yeah, that's a
because
very good one.
that has proven to be a very useful tool.
And if people want to get one of these, where can they get them? Where would they find these tools?
Audubon has them. In fact, about 3 or 4 years ago, I went to most of the places I could find on the Lower Cape, pet stores,
Right.
Audubon, nature store those types of things. I wanted to go to the big drugstores, CVS and so forth, but you have to go through the big headquarters in Rhode Island or something,
Right.
and I never managed to get.
And that was
through
to give them for free.
No, you would have to pay for them. You would have to
Okay.
pay for them, but I've forgotten what they were, but
Yeah, they can't be that
They're-
much.
they're
Yeah,
not-
$1 or.
I think they're a little more than that. They're stainless steel,
Mm-hmm.
and so.
Or they could call. Who could they call if they wanted to get a bunch to sell or have available?
And we do have some at the county, but we're not in the business of selling them.
Okay.
We don't have many left. That was
I would
one of the
imagine.
Yeah.
results of the budget cut from the state when we lost our state funding.
Oh, you
We-
lost this.
We lost that, yes. That was one of the
All
things
right,
we
so-
purchased with the state grant.
But now that you bring that up, maybe it's the kind of thing we should resurrect the effort to get those out there.
Yeah.
Like
It really.
Dog pounds and
It's an amazing.
people for cats.
It's a very,
things like
very
that.
simple, but very effective tool.
We made those available to people who work outside.
Yeah.
Land surveyors, landscapers,
Right.
tree wardens, municipal employees that work outdoors.
Good idea.
Is this the time when I should ask as to whether or not, the vaccine series that I took several years ago, and at the time, it was very painful, and supposedly it protected me, and then I found out after I went through the whole series, it was kind of problematic as to whether or not it was effective. Has there been any more conversation with regard, I know that more people are being diagnosed, with regard to protective measures that people can take?
Yes. Well, and to get back to the vaccine specifically, there were side effect problems with that vaccine, so it had to be removed from the market. And the problem is that lots of people are walking around with antibodies to Lyme disease, and they may or may not know it. And this vaccine, it appears, had the ability to arouse those antibodies and make people sick. And so it was decided that that vaccine could not continue on the market. At the research level, there are people trying to design a new vaccine. It's very tricky. Everything about Lyme disease is complicated and tricky. This diabolical spirochete has features and attributes that would confound the most brilliant biochemist, and does confound everyone. But they are still working on it. There's a researcher at the University of Rhode Island who's working on one based on saliva of the tick, and there's and in Europe they're working on it. But there's nothing out there right now. So your pooch is ahead of us in that case because we have a doggy vaccine, etc. Preventive measures are the usual that appear on the tick card. Take precautions when you're outside. The most important thing is to check every day.
Right.
Just check. I tell people, reach behind your knees first. You pick up the ticks below your knees, generally speaking, when you're walking. They don't jump or fly. You rub against something that has a tick on it, and it gets on your socks or your shoes, or and they always walk up. So this is why the advice about tucking your breeches into your socks and tucking your shirt into your breeches means that as they're walking up, they can never get underneath your clothing.
Right.
They're on the outside all the time. And if you wear light-colored clothing, you can see them. Doesn't deter them, it's just that you can see them.
Right.
And then, of course, there are sprays and deterrents, repellents that can be used. Some people do not choose to use those, but the most effective compound is called DEET, D-E-E-T, which is shorthand for a long organic chemical name. And you may spray that actually on your skin. Again, it has to be done carefully. And you don't really need it below the waist unless you're a gardener and you're into your garden up to your elbows and so forth. So DEET is very effective, and then permethrin can be used on clothing, and permethrin is used in the deer stations, which you'll read about, to kill it actually kills the ticks on deer. So there are methods such as that, and then one of the simplest methods around the home is to use wood chips, because there's one thing that ticks can't survive, especially deer ticks, and that is desiccation. When they get dry, they die. That's why they hunker down into the leaf litter. So when it's dry, they'll be in the leaf litter. That's where the mice pick them up. So if you're kicking through the leaves,
There you go.
That's where you might find them. But when it gets dry, they become they hunker down out of the way, and the cold will not kill them on Cape Cod. They do not die in the winter. They
No,
are
I
here
can attest
year
to
round.
that.
They are here
Yes.
year round.
Oh, yeah.
We know from the rangers at the National Seashore that in the winter, once the temperature gets up in the high 30s, low 40s, the rangers start picking them
They
up.
are there. Yeah, absolutely.
And by the way, the Seashore store has these tick removers.
Okay. And just one other thing, if somebody does have a tick and they remove it, what are the symptoms that they would experience if that was an infected tick? Do you know that? I know that there's the bullseye usually is seen somewhere on the body. It doesn't even necessarily have to be the site. And then it's flu-like
It
symptoms.
usually is the site, and they may have flu-like symptoms. I always preface my responses to these questions by telling everyone I am not a
medical doctor
or
That's
a nurse.
exactly right.
However, this is what I would do. I tell them.
Right.
First of all, the lucky people are the ones who have a very distinctive bullseye
Yes.
rash called an EM, which stands for erythema migrans, and most physicians recognize that now right away as distinctive for the illness and will prescribe antibiotics directly. The antibiotic of choice is doxycycline, and it is even possible to get that prophylactically now. It's been published in the New England Journal of Medicine that one dose, 200 milligrams of doxycycline, has been shown to, statistically, we think, prevent that Lyme disease bug from going further, should you
Okay.
have it. Of course, there's no way to know for sure,
That's right.
but to my mind, there's no real downside.
That's right.
One dose of doxycycline is not going to make you ill, for most people anyway, and it's not going to create biological resistance. So it's a good preventive. I personally believe, deep in my heart, that prophylactic measure has prevented hundreds of Lyme disease cases on the Cape.
I think that one of the points you've made in past time is the importance of retaining the tick and delivering it to someone who could examine it and identify to make sure
Exactly.
that it was indeed a
Thank you for
Tick.
mentioning that. Yes. If the tick is walking around on you, no problem.
Right.
My favorite method of disposal is just to put it in a little jar with alcohol in it and kill the tick. Some people flush them down the toilet, but that wastes a lot of water if you have. And so if you have a dog and you're removing ticks all the time, just plop them into a jar of alcohol and so on. If the tick has already taken hold and you remove it with tweezers and so forth, then you want to save the tick. If you notice that the tick is enlarged, engorged as we say, then you really want to watch the spot or seek advice or whatever. And this is when you might be advisable to ask for the prophylactic medication. But yes, the tick may not only be identified. People may bring the tick to the cooperative extension here and get it identified. It may also be sent off to a laboratory to be tested by a very sensitive technique for the presence or absence of the spirochete itself, which is a very remarkable thing to be able to do because you can't do it with human blood. But you can do it with a tick because the bacteria are so concentrated in the animal that they can test these. It's a DNA kind of test. And when you get the results back from that, if it's negative, you're safe. If it's positive, then it doesn't mean that you have the illness. It just means that tick was infected, and then you want to be careful to watch for symptoms, which could be the flu-like symptoms, could be headache. There's a whole myriad of symptoms,
Right.
Some of which are early, some which come on later, and so forth.
With animals that we've had, dogs, both of them, in the last several years, have been diagnosed with being positive for Lyme, and we've gone through a process where they've been vaccinated, and one recovered and all traces have left, and the other, every couple of years when we go back for wellness checks, it seems to be rising, and then they go through this process, and it reduces the the amount. But
Wait a minute, I don't understand. The dog gets tested for Lyme and it comes through positive,
yeah,
and then they do what?
they give them a vaccination. They go through a series of
I see.
shots, and then at least the vet, the vet that we've been going to for several years is giving them this. And then they're retested, and when they're retested, there's some evidence of improvement. And in one case, there was they came back positive rather than negative, or whatever the one that meant that they were through it. And in the second case, with the pug, he seems to go every couple of years when we go for the test. There's trace elements of Lyme that are still present.
But the animal is not sick.
No,
Right.
no. But but they were still.
See, here's the thing. We don't know whether people are carrying the antibodies or not. They probably are. But the testing for humans is so iffy that it's not really possible to know to what degree this may or may not be a problem. And no one has ever recommended that healthy people go have a Lyme test. There's no reason to do that.
Right.
Even when people have the Lyme test, some people produce the antibodies in a robust numbers, and some people do not. So some people will get a positive Lyme test and receive treatment, and some people who may be very ill come back with the test is negative.
Right.
We really need the science. We need the research that can produce a definitive test.
Mhm.
We've been saying that for the whole 10 years that we've been in business, and we continue to say that.
Okay.
Is that why the controversy among the physicians still exists?
Yes, I will talk a little bit about that.
So you have some more to say. So
Okay,
let's go.
we could go on quite a while.
I
don't know how much
So-
time.
so
I don't know how
we'll-
much
I
time
know.
you have.
We don't.
Okay, here's our situation. As you know, our task force is appointed by the county commissioners.
Yes.
We were first appointed in the late fall of 1998, so we are now more than 10 years old.
Mm-hmm.
So I made a quick list this morning while I was having my coffee of what I think are some of the highlights of our accomplishments. And we're at a point right now where I think we sort of need to go back, review the mission, reinvent the Lyme task force a little bit, seek some new nominees, etc. And so we would like to ask for your assistance for some of this, okay?
Mm-hmm.
First of all, on the top of your sheet are our so-called bylaws. They're still pretty good. They're 10 years old. You will see Stetson Hall signed those in October of '98. I don't think much needs to be... we want to look at number 5. Our task force has done most of its work by subcommittees, to tell you the truth. So we haven't had a full task force meeting in quite some time. But I'm going to come back to that because I'd like to talk with you about that. And then, where does it talks about the chairman? Number 8. Number 8 needs to be revised because it calls for co-chairman, and one of them is the director of the Department of Health and Environment, and that means, of course, that the director of Health and Environment is the co-chair of his own advisory committee. So that's
Very convenient.
so far it's worked very well.
You haven't worked it.
I'm sure it has for that particular chairman.
But so that's a technicality that we ought to fix. Anyway, you might want to just look that over and see what you think of it.
Do you have a recommendation?
I think there probably should be a co-chairman elected from the task force, but with other government advisory committees, meetings do not occur unless there's a staff member from the agency or whatever present.
In some cases, we solve that by providing ex officio staff members, not without a vote,
Uh-huh.
to be assigned to the committee.
That's another thought. That's another thought. We don't vote very often. We do most things by consensus.
Yeah.
And you'll notice that a majority of members constitutes a quorum. That's very convenient. Especially, let's see, does the next page have the list of people? Okay.
Yes, it does.
You will see that the members are very busy people.
Yeah, I was going to say.
And it's almost impossible to
get
find
a
a
quorum.
time during the day
Right.
when people come, especially physicians.
Mm-hmm.
So it's been my practice to try to schedule meetings when physicians can be there because they're so important to our discussions and so forth.
Should Lance be taken off of this?
Um,
I think he was on there representing the commissioners.
okay, well, that would be up to you.
Mhm.
As I'm going to suggest when we come to the end of this that we send a letter out saying that we're going to start over. If you'd like to
Right.
continue on the
On the
task
board.
force,
Mhm. Yep.
so if Lance is a representative who's nominated by you, then you can choose someone else or whatever.
We're all nominated by us, I believe.
You're appointed by you.
Excuse me, appointed, yeah.
Yeah. So anyway, and you may have some ideas. After all these, you probably know people who might be able to contribute
Mhm.
in a productive way to our conversations. Normally, we've had committees, for instance, for education, and the last major committee that's been at work, and I'm going to resurrect it pretty soon, is the Committee on Legislative Efforts, up in because there are a couple of bills that are being refiled on Beacon Hill as we speak, and so we're going to want to follow that again. But I'll come to that in a minute. So I think there are 18 names on that list. It has shrunk a little bit, but that's okay because I think we can operate with a small task force.
Yes,
Actually,
you don't need a-
we had a large task force to begin with, but we can operate now, I think, with a smaller one. If you turn to the next page, you will see that we've hosted what we call physician forums. They're not always physicians, but we've had medical forums for nurses and for people in the field and so forth. But this is the kind of thing we can't do now because of the budget cutbacks. On the other hand, I think that that we had a very good series of these, and it's time now to do something else. So
Right.
we had some great support from physicians. Physicians came from all over the Eastern Seaboard, actually, to contribute to these. We paid their travel expenses and overnight expenses. And we found them very interesting. Also, on the next page, you will see the cover sheet from the Director of School Health Services at DPH. We actually we actually created these documents, which are guidelines for schools. And the Department of Public Health endorsed them and distributed them
Oh,
and credited us for it.
very good.
Very nice. So I would like to say that all of the educational materials that we have developed with our subcommittees and with the expert assistance of Dave Simser and Rita Mitchell have been adopted.
Excellent.
Not just endorsed, adopted by the Mass DPH. For instance, the tick cards, they put Mass DPH on and circulate them.
You pay for them?
Do they?
Yes,
Yeah.
we don't.
So anyway, that's a great endorsement for us. Then I added to this, I excerpted the pages from the county annual report written by Dave Simser about his Lyme program. So that's in there. Thank you. Excellent annual report. I always enjoy reading it, by the way. And then the last thing in this particular packet is the bill that Representative Jennifer Callahan filed last year. It didn't make it through to a vote. It almost did. And she's refiling it again. And you'll see some familiar names co-sponsoring it.
Yes.
And there'll be more, I'm sure. It's very brief. If you look at lines 8 and 9, you will see that we, the Cape and Islands Lyme Disease Task Force, are specifically mentioned as having a representative on that commission. This is a commission that will do some studies and prepare more legislation, essentially.
Excellent.
There's also a bill that's being refiled by Representative Theodore Spiliotis, which has to do with mandating insurance coverage for Lyme treatment, and my guess is that will have tough sledding in the present climate, which is understandable.
And that had to do with the opposition of physicians, as I remember, because I think I had to pay for my vaccination back 10 years ago when I done it.
Yes, that would have preceded any of this legislation, but Rhode Island has a bill. When Representative Shirley Gomes was representing the 4th District, she got the ball rolling up there and started the bill patterned after the one in Rhode Island. And we helped her with that. So that it was not successful, but it got things started. And now the Joint Committee on Public Health is very interested in this. And so we'll see what transpires. There's an understandable reluctance on the part of the legislature to get into medicine, obviously.
Right, absolutely.
And this is especially true now because the medical community is polarized regarding the treatment of chronic Lyme.
Right.
So, and I'll come back to that. What I wanted to do was just highlight some of the things that I think have been important that we've been somewhat instrumental in facilitating during the past 10 years. We're not responsible for all of it, but we've played a leadership role, and I might say that is the Deputy Commissioner, Dr. DiMaria?
Yes.
At DPH has told me more than once that he wishes that our work could be emulated out in other parts of the state, and he's been extremely supportive. He remains very supportive.
Very good.
But his budget problems are really serious, and so he's unable to do even as much as we're able to do now. We are able to get some of our materials out. The educational materials, this kind of thing, has been major.
Yeah, they're great.
When we started this task force more than 10 years ago, there was nothing out there. And how it got started was, when I moved to Truro, I called Stetson, because I knew him through the college, and I said, there are a lot of people down here who are having real problems with ticks and Lyme, and we don't have any information. He said, gee, I don't really have anything to offer. And I said, well, you know what, we got to write it ourselves. And that's how it started. And so we started with these brochures and so forth, and each time we honed it and improved it and so forth until we have what you see before you.
They're great.
Our original tick cards, believe it or not, were laminated. They had real ticks on them. They were made by the graduate students at the University of Rhode Island, and they cost $8 a piece, I think. And we all had one, and we would keep it in our pocket. And then along came colored copiers, and Dave Sims had discovered that he could get a pretty good rendition of these, so he made colored copies. And then we moved to computers, and now we have this polished-looking laminated tick that will last,
nice.
And we're able to purchase those and send those out. And now, of course, all of these printed materials cost part of the budget, and so we're riding on what we have left over. So
Right.
we're trying to be careful about that. Dave Simser has also done radio and TV pieces. He has the newsletter, which you see here, also produced. You may see these around
Yes, I have seen
around the
those.
Cape.
In the
which
outside in
alerts
the
people.
woods and that
Yes.
sort of thing, yeah.
National Seashore has posted them. Towns, golf courses, parks. It's a very useful.
It is
It's a
indeed.
very useful highlight. So it's hard to find people now, I think, who have not at least been introduced to the notion they need to watch out for ticks.
Right.
And that's a huge step forward.
Right.
The medical forums I've already mentioned. The policy guidelines for the schools. The outreach. Of Dave and Rita with the public. Rita goes to the public schools. She goes to the wellness clinics. She distributes information. Let's see. I have she produces documents for the schools games.
Oh, good.
It gets the kids involved, asking questions, and they get a certificate after. So, I mean, it's just wonderful to get the youngsters
Aware.
tuned in
Right.
and aware
Right.
and watching out for each
Because
other.
they're the ones that are out there playing in the grasses and
Well, and part of the policy guidelines that we prepared for the schools, of course, deals with how do we take care of our youngsters on a field trip.
Mhm.
And I've had calls from parents. My daughter's going off to camp.
Right.
What should I do?
Right.
Etc. And you get into the business of hazardous materials and how to deal with bug sprays and so forth in the school. You can't have the teacher spraying the kids. You can't have the kids spraying each other. So what the guidelines say is if there's going to be a field trip, the parent should spray the child's clothing before they go.
Mm-hmm.
And, no sandals, that kind of thing. So very common sense. And then a tick check at the end of the day, when you return.
Yeah.
And also, if you have kids, even adults, you can use the buddy system. For instance, when we do the highway pickup in Truro, we watch each other.
Right.
I see a tick on the back of your britches,
Right.
That kind of thing.
Right.
And kids tune into that very easily. So it's a matter of getting them interested in it, and they'll usually follow along. Dave's work, I don't think it's possible to overstate the importance of Dave's work as our county entomologist. He has been gathering data with the tick surveillance and tick testing program that's available nowhere else. We're providing data to the Department of Public Health. But that tick testing is now on hold until we can find some way to get a little more funding and so forth. He does the intervention studies, in other words, trying to figure out how to protect people from ticks outdoors, hence this tick management brochure. So, and then of course he has a program that he takes to the public, which is outstanding, wonderful graphics. He's very good at that sort of thing, and he loves his work. So, and then Rita, of course, is an RN. She goes out to the schools. She participates in the public forums and anyway, I personally am very proud of the county work. And for me, since retired, I've been involved in quite a few things, but this Lyme Disease Task Force is the most satisfying, rewarding work that I've done since I left the community college.
Oh, so you're at the community college. Okay.
Yes.
Well, I just want to say, I think you should be proud, and we are proud too, especially of your accomplishments that are recognized, and rightfully so, across the state. And I think that's a tribute to all of you and the hard work that you do, and also just looking at the situation and how can we best deal. It's our responsibility to make people aware of this. All of those things that you were saying are just habits in our household now, because
Isn't that good?
ticks are so prevalent. And when I see someone standing in the grass or sitting in the grass, I always get nervous. I always want to go over and say, you should really just be...
Yep.
I don't want to make them feel like, not to enjoy yourself, but I have come home and had, literally, and I thought I had a T-shirt tucked in, but I had like 2 or 3 layers of sweaters walking through the woods, and I had about 5 ticks on my back.
I had no idea you were a tick magnet.
Oh, I am a tick
True.
magnet.
Some people are. Some people
There
like
is no
mosquitoes.
doubt about it.
Some people
Yeah,
who don't
they
seem
like
to
me
attract
too.
them.
Yeah.
And so on. These are the things we can do: the education piece, the awareness piece, the go out and do talks and so forth. The huge problem for people who have Lyme disease, especially if they haven't been adequately treated or they haven't responded to treatment, is getting aggressive treatment. It's a very complicated question.
Mm-hmm.
And there are 2 groups of physicians who have opposing views about what to do about long-term chronic Lyme disease. And there are no clear answers. Some physicians treat aggressively with antibiotics over long periods of time, and of course, there are problems with that. The antibiotic can make people sick, and and there are long-term biological problems with that. On the other hand, if a person is terribly ill with Lyme disease, there doesn't seem to be any other treatment options at this time. So we find people leaving Massachusetts and going to Connecticut and New York, where there are physicians who will treat more aggressively. And this has become a very, very tough problem, especially for the Lyme patients, but also for the physicians. And so there are two sets of guidelines for treatment out there, and they're being argued. And you may have read last year that the Attorney General in Connecticut has required the conservative doctors to reconstitute a panel they have for the guidelines, because he threatened to take them to court because they would not admit to their discussion those physicians who had opposing views about this. So it's a very difficult situation, and that's not the kind of thing we can get into. But we have been advocating for the legislation and trying to assist also with what the legislation says, and we will probably continue to do that this year with the bills. We're going to keep track of these bills, and since they're refilings, we won't be starting from scratch here. But at some point, we may ask if you would be willing to, as county commissioners, to write a letter of endorsement if we think it's a good, if the bill looks like it's
Anytime.
good.
Yes,
And so the other thing, I mentioned the mission statement. We need to look at the mission statement. The possibility of identifying new members, and of course we're always looking for ideas about funding opportunities. I'm thinking that since we're at this 10-year mark, that it might be a good thing to actually have a task force meeting this coming fall and ask you to host it as the appointing governmental group, and maybe have a program for the task force members. It could be some of the things we've all talked about, because they're not really in the loop unless we have a special meeting about something, and then it's always because there's something we got to accomplish, and everybody's very busy, and we only have 2 hours and so forth. So I was thinking that if we had a meeting in the fall that was kind of a kickoff for.
Give them a charge.
Well,
Yeah, and
Well,
go ahead.
I was going to say, like, even a 10-year assessment
yes.
of the
What's
the
happening.
task force,
Yeah.
and what
What's
are we going to
different?
do, and what's going to happen in the next 10 years? What do we need to accomplish?
Exactly.
And
Ask for their
and
input.
Ask for the yes.
Ask for their input.
This is what
in
we've
how
done
do
in
we
10
move from
years,
here?
and how do we get to the next 10?
Also, I might add that a chairman after 10 years ought to be replaced.
There are no term limits,
How could you be replaced by? Replacement is, you might be succeeded, but not replaced.
Okay.
I've been on a housing authority for 20 years now, and I've been looking for a replacement for the last 18. So the nuts and bolts are, you want a request for a continued interest sent to the members, revise
Right.
the bylaws, and then have a re-examination of the mission statement. Is that the three things?
Yes, and then host
And
help us
host
host a
a
meeting.
thing, yeah. And that would be very good to put a highlight on the topic as well. We could make sure and
Yep.
celebrate 10 years of
Exactly.
accomplishments.
Yep. Yep.
And I think that's a great thing, and I think we could do that.
What I think I can do is report to the members of the task force about our meeting this morning, and let them know that at the end of the summer they're going to hear from you.
That would be-
And I can help you write the letter if you want me to.
Yes.
That they're going to hear from you, and that we're going to request, their sense of interest in continuing and seek nominations for new members.
And
as
we
well.
could have it in the evening. We could have it in the early evening, and it also would highlight the fact that ticks. There's another season a renewed season of ticks. They come out in October. You think they've gone away with a little bit of cool, and then lo and behold,
Actually,
that
fall
Indian summer,
ticks.
yeah,
I've
fall
had
ticks
two
are-
bad ticks.
are-
Both
yeah.
of them have been picked up in November.
in the autumn.
And,
they're wicked.
And the biological reason for that is that the adult deer ticks by then have had 2 opportunities to pick up the bacterium, so they're twice
Oh.
as likely
Yeah.
to be infected in the
With
fall
Lyme. Yeah.
as the
okay.
nymphs are in the spring.
Right.
I picked up ticks putting up Christmas decorations one year, so you're absolutely right.
Right.
By the way, is Dave Cisner available to do another TV program? Because it sounds like this is something that's topical, and we should do that
Oh,
again.
absolutely.
Ask him about this in a second if he's available. At 3:00. He's been there before.
Mhm.
Okay. So
Okay.
if you get back to me on that would
Yep.
be great.
I just had another thought, Brenda. Perhaps Cape Cod Healthcare might participate in this event in some fashion. I don't know, maybe not. And even the State Department of Public Health.
Yeah, we could send.
Okay,
an
yeah,
invitation.
we're
We
Well,
can
let's
make-
see. Peter McKay works in the emergency room at Cape Cod Hospital, right?
Peter McKay is a member of our task force.
Yeah.
Yes, I see
Yeah.
that.
Okay, and the other,
And Brian O'Malley
Brian
also is on the
O'Malley.
board of Cape
Yes,
Cod Health.
yeah.
And the Barnstable Medical Society, perhaps, I mean, get some
Brian
groups to
O'Malley has
sponsor
been
that
our
might
contact
elevate
at the hospital.
discussion some.
And so he might, that's a very good idea.
Yeah. that
I
would
mean,
be
it's
great.
so logical. Sometimes the most logical things you don't think.
Yeah. The more the merrier.
Well, yeah, let's think about that. Let's make this a special meeting.
Yeah, it would be
And,
fun. I mean, it would
early
be- it would
evening
be
is
a
probably
good
a
way to put the
regional,
topic on it.
regional significance.
Yes.
Okay, so this will be,
Had
this
to
will be
get that in there.
exciting and informative.
Let me ask my gentleman
yes.
friends here if I've left anything
I was
out.
going to say, I'm
Well, I
sure.
think you did a super job.
Yes,
And I
absolutely.
think Brenda should be recognized.
Yes,
Yes.
yes,
Yes.
I know, you're busy recognizing everyone else, but you've done an incredible job, and you've loved it, which is also a wonderful thing, but it's a lot of work, and thank you for that.
Success
It's,
means
and
work.
success, yes. George, do you have,
No.
no?
Uh, For one thing,
Extremely
said it all.
helpful. Yes.
Okay,
That's
well,
right.
you're well flanked.
Very, very supportive and
That's great.
very, very, really skilled at administering these programs. I mean,
Yeah.
they've got so much going on
I
under
know.
their umbrellas.
Yeah.
And I'm just so pleased that they're interested in the Lyme disease and that the staff members are also. Again, it's getting a little harder for them because, for instance, Rita no longer has a support for her nurses. She's doing it on her own now, and fitting it into her other duties, and that's what they do. I mean, it's just fantastic. We will keep this going
Right.
one way or another, but it will just
Right.
be at somewhat diminished level until we can find some more funding.
I was thinking another thing too, Brenda, by having this program, what are we calling it in the fall? That would also probably help to support the bill that you're going to file because it would create a lot of
Indeed, you're right.
attention
You're right about
and
that.
bring
We'll
in some of
make
the
in our
important players
state
that can help
delegation as well. We'll
help
invite
make
them.
that happen.
Yes.
Can you
I'm
recite?
glad you mentioned that because I should say they've all been very supportive.
Right.
Cleon Turner,
Yeah.
Sarah Peaks, Shirley Gomes, when she was up there, she
Right.
was really carrying
Oh,
it, and Rob O'Leary and Eric Turkington. Eric Turkington was the one who squired through the funding when it was available. Made sure we never slipped up on that. All of our legislative delegation have been very, very supportive, and so yes, they should be invited.
Okay, great. Are there any questions from the public on this topic?
Can I
Yeah,
ask
Matt?
one brief question. If you could just address generally where we are with the prevalence of Lyme disease in Barnstable County, how we're comparing to other parts of New England, to the degree of your knowledge, where we are right now with the prevalence of it.
Yes, let me just look for this
I think I
graph
have
in
the
here.
graph in here.
Let's give you a copy of it. In fact, I can give you a copy of this. You like to have this?
Sure.
There's a graph in here, which Dr. DeMaria gave me last summer. The numbers are always delayed by a year or more because the reports come in piecemeal. You can find it.
Thank you very much.
But here's the thing. The tick and illness situation is not getting better. It's getting worse. There are more ticks. There are more different kinds of ticks. We have the Lone Star tick now, which also carries it carries a bacterium that's very, very close to Lyme. There's a little argument in the science world about what to call it, but it makes people just as sick. There are the co-infections, which I haven't mentioned. One tick can carry 3 illnesses, maybe even more, but 3. Lyme disease is the one we all talk about, but there's another one it's now called anaplasmosis, or anaplasma, which is, its former name was ehrlichiosis. It's quite common.
Mm-hmm.
I know someone who's just had a dog treated for that. And then the third one is the one called babesiosis, which is a malaria-type infection. It makes people very sick. And it was found originally on Nantucket. I learned recently that babesiosis, when it was discovered on Nantucket, Lyme was considered a co-infection for babesiosis rather than the other way around. Isn't that interesting? So ticks, I don't want to frighten the world about this, but
Right.
but Lyme disease is the one we key in on because it's the most prevalent. But there are co-infections. The ticks are being distributed by birds. So they're moving up from the south, generally speaking.
Mhm.
So if you look over the time when we were kids, we had the dog ticks. I don't ever remember deer ticks.
Right.
I had a professor at the University of Rhode Island who predicted, he said, I predict that you're going to have a Lone Star tick within a year. And sure enough, we found one in Wellfleet. This was in '02, I think. And now Lone Star ticks are being found in higher numbers. So you look at the numbers of ticks, the different kinds of ticks, the fact that they're being distributed by birds, and
the prevalence of the disease in
and
the ticks.
yes, and the prevalence of the disease in the ticks. It's something that really needs to be addressed, and we just got to do our best in informing people and showing people how to prevent it. The only way to prevent these illnesses is to get the tick before it gets us.
Right. Bill, you had, I know that when we do our tour
Mhm.
with you in the summertime, we
Yes.
stop by the garden there that has the deer tick research, and it shows how the deer, you have these sort of like deer licks in a sense, and they, by going to them, they rub against something and they get this medicine put on them which prevents it. But you also had statistics about how many ticks, what is the percentage of ticks across the Cape that usually have
Which
have the
is that carry Lyme
disease,
disease?
that carry.
Of the adults, it's close to 50%.
Wow.
So 1 out of 2. Of the nymphs that are out now, somewhere between 15 and 20% on an annual basis.
Okay.
Although more people get Lyme from the nymphs because they're so small.
You're right. They don't notice.
They
it.
don't notice
They're there
them.
for a long time.
So roughly 1 out of 5 of the nymphs.
Okay. Any other questions?
I
George?
think I'd just like to, so the take-home message, it's always difficult to know in public health how much to really alarm people to the point where they, this stays on their radar. And I think the efforts of the Lyme Disease Task Force in the past years has been very methodical. First, reaching out to the physicians, running those physician forums was the first step in getting the medical community aware of what's going on out there, because they were not. Now we see those sort of forums even mimicked within the hospitals. So the medical community sort of base had to start. Then reaching out to the public without alarming them. No one likes to see a big picture of a tick inside a hotel where you say, "Ooh, I don't know whether I want to go to that hotel." But we've, through the Lyme Disease Task Force, identified those critical points, those educatable moments that aren't, gee, watch out, the world's going to end, but rather, no, this is something we have to be cognizant of, know, and take steps to prevent. and Bill's program, particularly those that talk about what to do on your property. Those are huge. I get calls and I defer them all to Bill's department. What can we do on our property to keep these things at a minimum? So all the steps have been going right along, but I always tell people, I say, there's probably 3 things you really ought to watch out for on Cape Cod in the summer. 1, buckle the seatbelt. 2, get the sunscreen on. And 3, do your tick checks.
Check, right. And that's really,
Right.
and do all those and you can have fun.
Right. That's right.
So.
Good advice.
Well, thank you
Thank
so
you.
much.
Thank you.
We will
Yeah,
follow
that was
up
great.
on, we'll have to have you in here and we'll follow up on some of,
Okay.
doing the mission and we'll definitely get that rolled out in the fall. In, another month or so we should probably start, getting those letters out. Or less than really in June. If we want to pick a date, maybe early October would be nice. And,
Okay, is it appropriate for me to sort of be thinking about this, maybe
yes,
draft a first letter
and remind us.
and just
It's
talk
very
with you?
appropriate.
Talk with you as chairman?
Yeah, that would be
then,
fine.
And then if you want us to come back to talk with you at a regular meeting, you can tell us when the appropriate time for that is.
That would be great.
How's
But
that?
but keep in
Sounds
touch and remind
Yeah.
us, and we'll stay with it. Good.
Good.
Yeah.
And you'll have Dave,
You won't be bugging us.
Dave, give you a call. Yes.
Right.
Great.
Okay.
Thank you very
Thank
much.
you.
All right.
oh,
And who's? Are you here to?
That might be for the next meeting.
Oh, all right. What is the?
I have something just
What is the
in.
next meeting?
We have a meeting.
Oh, are you here for the rest area?
Yes. Okay.
Oh,
that-
the armor. Okay, so we gotta go.
I just had
No,
a
it's not till
notice.
11:30.
All right.
I just had a notice by email saying that we've been awarded a community service recovery funding. Barnstable County Resource Development Office and the AmeriCorps Cape Cod program received official notification of a recovery grant funding award of $153,390 from the Massachusetts Service Alliance from the Cooperation for National Community Service to recruit, train, and engage 6 residential AmeriCorps members in a boots-on-the-ground effort to respond to the troubled economy. The Recovery Act funding was competitive but only available to existing AmeriCorps grantees. The Recovery Act funding includes engaging 6 new AmeriCorps members. AmeriCorps Cape Cod will partner with Housing Assistance Corporation in Hyannis. Residents will be provided by HAC for the 6 new AmeriCorps members. The program is funded in response to the economic turndown, but will only operate for 1 year. AmeriCorps members will be engaged in nonprofit capacity building service, which will include group and individual service focused on housing assistance and housing foreclosure prevention and other critical, immediate capacity building needs. Program staff coordinator will begin August 1st, 2009, with AmeriCorps members slated to start training in September 2009. And it mentions that they'll go to a general press release this week, and
Where did you get this from?
they just got an email from Darlene.
Oh, great.
Yeah, so since
Very good. Yes.
people should know
Congratulations,
that.
Darlene.
That's great.
Thank you.
All right. Well,
We have to vote. We have to vote.
Oh, we have to vote on our
Summary of actions?
Summary of action.
Our items.
I didn't have any questions on any.
I don't know.
I didn't either.
I'll move approval of items 1 through 18.
I second. All in favor?
Aye.
Aye. So
Here's a
moved.
copy.
So done. All right.
Move to adjourn?
I.
We
Oh,
still
we have
to
something
meet.
else? What?
We have to meet at 11:30, don't we? So we can't
No, that's a
adjourn.
task force
That's a
meeting.
task force.
It's
That's
not
a
the
county
commissioners meeting.
Where's Mark?
Mark
Mark's
is
not here
his
today.
daughter is sick, so he's home with his
Who's taking
child.
his place on that?
May.
Oh, you are.
Pat is
All right.
standing in
That's a
for
copy
us,
of the-
and Maggie Downey is in Albany, New York, at a energy
Right, yeah.
Uh, forum of some sort. Bill, don't forget to sign.
Oh,
Yours.
Yeah, you have to,
Is
you,
this-
the other pages need yours, and I'll finish up. So, my motion to adjourn?
Oh, okay.
Second.
Well-
Is that
well
okay?
taken.
All in favor?
Okay.
All right, we're adjourning. Thank you so much.